Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, the topic is access to healthcare, with a focus on a population heavily affected by COVID, but often ignored by policymakers: undocumented individuals. Dr. Josh Sharfstein speaks to Luvia Quinones, Senior Director of Health Policy at the Illinois Coalition for Immigrant and Refugee Rights. Joining them is Mervyn Dino, who runs a safety net healthcare program at Advocate Aurora Health in Chicago. Recently, both were involved in successful advocacy efforts to expand access to healthcare to undocumented immigrants in Illinois who are age 42 and above. Let's listen.
Mervyn Dino, Luvia Quinones, thank you so much for joining me on Public Health on Call. Over the last decade or so, the United States has made a lot of progress in reducing the number of people without health insurance. But there are certain groups that have been left behind, and among them are undocumented individuals, as well as young people who are part of the DACA program. What are the consequences of their inability at times to access health insurance? Maybe I'll start with you, Mervyn Dino.
Yeah, thank you, Josh. Appreciate the opportunity to be here. So undocumented immigrants living in the U.S. represent a historically marginalized group. And back in 2010, when the Affordable Care Act was passed, undocumented immigrants were excluded from health insurance programs. And so, as we've seen in recent years, the longstanding humanitarian crises at the U.S.-Mexico border, coupled with anti-immigrant political rhetoric, this has really all raised serious challenges in providing equitable care for the undocumented. And this is a community that's previously and continues to seek care mainly in our hospital emergency departments and many community health center settings, such as federally qualified health centers. And so it's a really disadvantaged group that has experienced significant barriers to accessing care.
Let me follow up with you. I know that you work in Chicago in the Safety Net Health program. Do you see consequences from people not having access to health insurance?
We see that the consequences have really been drastic, and particularly the COVID-19 pandemic has been devastating for our undocumented community. We are seeing that during the pandemic, especially during the height of it, many undocumented people and families needed to wait until symptoms got really bad until coming into the hospital. And so this meant that our undocumented patients became sicker and more complex and even more difficult for our hospital and even healthcare providers to treat. And so seeing this firsthand and being directly with undocumented immigrants, we see that there is also a growing mistrust in the ways in which healthcare can be delivered to them, as well as the access that's available for them.
I'm going to turn to Luvia Quinones. Could you reflect on the challenges you see it? I know your advocacy group must hear from many people who are in need of healthcare.
Sure. Thank you, Josh. We see, unfortunately, a lot of issues, as Mervyn mentioned, people delaying care. The fear of when you're uninsured and undocumented, it's both the fear of ending up with a high hospital bill, and for many people, also seeking certain services makes them think that those services could affect their immigration status in the future. So unfortunately, some of the barriers. When it comes to consequences, the other issue, in addition to what Mervyn shared, is because of the fear of something affecting the status, there are many times where undocumented parents end up not seeking care for the children out of fear that service for the children could also affect them. So we're seeing, unfortunately, time and time again, that the health status of families, of immigrant families, have been deteriorating when it comes to either the dentist and many other situations. So unfortunately, the need of these services being culture sensitivity, as well as in their own language to make them aware of what they are eligible.
Got it. And I'm a pediatrician, and some of the consequences go beyond even health, because if kids can't make it to school, then they won't do as well in school, which may affect their future ability to contribute to society. There are also other consequences, and the infectious disease issues that Mervyn raised are important, because in a way, we're only as healthy as the least healthy members of our society. And so if there's an infectious disease being transmitted, it's better for people to get care regardless of who they are. How does that, go ahead, Mervyn.
Josh, I was going to add that so there are a lot of great efforts happening and a lot of grassroots advocacy that is happening, not just in Illinois, but across the country. And so undocumented immigrants do have places to seek care. There are federally qualified health centers, they're free and charitable clinics, and many undocumented patients may pay out of pocket for many services and not knowing that these resources are available to them. And so while there is some, there are safety net programs that do exist in parts of the country, but we know that safety nets just aren't enough to care for an undocumented immigrant population that is aging, that is becoming increasingly more sick and more challenging to treat.
So as this picture has developed, as it's become more clear during COVID, what are states doing to address the healthcare needs of undocumented populations? Maybe I'll start with you, Luvia.
Sure. So there are some states, including California and New York, in addition to Illinois, that have been passing legislation to increase health coverage for undocumented individuals. Even though at the federal level, there are no health care, the health insurance coverage for undocumented as well as for DACA individuals, California, New York, as well as Illinois have been expanding their Medicaid program to cover more individuals, which is something that Illinois have the right, the states have a right to do. Most recently, in Illinois, we were able to pass legislation to now provide a very similar program to Medicaid to undocumented individuals, as well as a few other statuses for Medicaid. So as long as you live in Illinois, either undocumented, have temporary protected status, or have a green card for less than 5 years, you're not going to be eligible for Medicaid-like program. And California and New York have done similar efforts.
Now, when the states expand Medicaid for populations not permitted in federal law, the states have to pay the whole bill.
Correct. The one part that they are able to get reimbursed is when individuals, depending on the income, for emergency Medicaid. That part.
Got it. That's for certain emergency services, the federal government will share in the expense.
Correct.
But for the regular services to prevent emergencies, it's all on the state. So I wonder if you could talk, Luvia, a little bit more about what it took to get this passed. That basically, you're going to the legislature, to the governor in Illinois, saying, we in Illinois need to spend more money to make sure that this group gets healthcare. What is that like? How does that play out?
Sure. So I'll say that it was definitely challenging, and it's something that I always say that something when it comes to undocumented individuals is always going to be challenging because of the cost. So this effort started over 5 years ago, led by a campaign called the Healthy Illinois Campaign, which we are steering committee members. And I would say in the last 3 years, it ended up picking up more interest as well as more supporters in our state legislature, because we were able to show when it came to COVID, who were the individuals that were the most impacted. So not only, as many of us know, undocumented individuals continue to work, so what became known as essential workers, similar to also in the African American community, but undocumented individuals were also the ones that were the highest hit, as well as African Americans, when it came to who were the ones that were the most infected. Unfortunately, also the numbers of who were the ones that were dying when things could have been prevented. So really focusing on that. And then, as we know, the first year of COVID, The other group that was also, unfortunately, very impacted were senior citizens. So that's why the first expansion that happened were for people that were for 65 years and older. So it was very much not only showing the importance by public health data, but also really using what happened, unfortunately, with COVID as another reason why in a public health emergency, everyone should have health coverage.
So what do we see in other states?
So, for example, California is going to become the first state to achieve universal health coverage starting in 2024. But we know there's a lot of advocacy work that needs to take place. In other states, we are seeing similar models being developed, but there's a lot more work that needs to be done.
Sounds like a very politic answer. I appreciate that. And I guess to you, Luvia, I wonder how advocacy plays out within the population of undocumented individuals themselves. This is something they obviously need. It makes sense for the state to provide, but it can be more difficult for them to advocate for this. How does that work out? What role does your organization play?
So as an organization, we've been doing advocacy, organizing, policy efforts for over 30 years. So I'll say that it's not easy. There's definitely a lot of challenges. And also because for us as an immigrant rights coalition, our goal is to involve and include all immigrants and refugees in this effort. Given some of the cultural challenges within each community and each group, sometimes things have to work and have to move a little slower because we want to make sure people are feeling comfortable. When it comes to just getting people involved, especially when they're undocumented, some of the challenges that I'm referring to is people knowing that they have a right to advocate even if they're undocumented. That's the first part of really addressing and really showing people that it doesn't matter if they're not able to vote, they're still paying taxes. The state senator, the state representative still has an obligation to represent them, and also really bringing them to those positions of power, whether it be the state capitol, whether it be them, the undocumented individual person, having a conversation with their elected official. So our coalition, our organization really focuses on that, on individuals finding their own voice and finding their own power for them then to advocate for themselves for the issues that impact them directly.
If people are listening and wondering how they can get involved in supporting these kinds of activities in their state, what would you recommend?
For people that would like to get involved, there are various opportunities, including getting involved with your local immigrant rights organization. There are organizations like the one I work for, ICIRR, throughout the country, not in every state for the majority. So that's one option. The other thing also is that if you are a public health professional, there are things that you could do directly within your hospital, within your clinic, to make sure that all immigrants feel welcome within your institution, from creating certain policies to doing certain practices internally. And then, of course, if you want to get civically engaged, making sure that your elected official knows where you stand on certain immigrant health issues.
I wonder, Mervyn, if there's something that you would like to add to this. I think your earlier comments about the importance of healthcare being responsive to immigrants really is part of this challenge. We both want people to have access to healthcare financially, but also to feel welcome. What does your organization do? What do you think are the key ingredients for that within healthcare?
So right now we're participating on a statewide coalition called the Alliance for Welcoming Healthcare. And this is a statewide group that brings together many different healthcare organizations seeking to promote better, more inclusive and more welcoming practices for undocumented immigrants. And I'll just say that as Luvia mentioned, this work really is not easy. And healthcare providers need to be more mindful of bias and discriminatory practices that result in immigrant patients being turned away for care based on their inability to pay or seek care. And so increasing the education among even residents in training, among even nursing students in training, public health practitioners in training is really important so that immigrant patients can feel more welcome. And so in terms of the policy work, there's still a lot of work that needs to be done. We still have in Illinois undocumented eligible low-income adults ages 19 to 41 who are still ineligible to seek care. and many individuals who do have deferred action for childhood arrival status who are still ineligible. And so there's still gaps that need to be filled. And this places an increasingly challenging burden on our safety net system that's already been plagued by the devastating pandemic.
Well, it sounds very much like this is a work in progress, but it's very important work. I want to thank you both for doing it and for joining me today on Public Health on Call.
Thank you for the invitation.
Thanks, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.